Hello everyone, I am Dr. Divangi Patel, second year resident in Radiology Department at Siusa Medical College and Hospital, Surendranagar, and I am presenting the case in Case of the Week series. History: 29-year-old female patient came for routine antenatal ultrasound, second gravida and 8th month of amenorrhea, with previous history of caesarean section. Ultrasound images showing placenta lying in lower uterine segment with placental parenchyma completely covering the cervical internal os and loss of retroplacental clear zone by invasion of placental tissue in anterior uterine wall. T2 weighted axial MRI image showing focal bulge in myometrium at anterior uterine wall. T2 weighted sagittal image showing focal disruption of myometrium in anterior wall and loss of retroplacental T2 dark zone. Final diagnosis: placenta previa grade 4 with placenta accreta involving anterior wall of uterus. Discussion: placenta accreta defined as abnormal invasion of placenta into myometrium of uterine wall. Etiology: defective development of decidua basalis and excessive trophoblastic invasion. Risk factors are previous caesarean section, placenta previa, advanced maternal age, dilation and curettage, previous uterine surgery. Complications: damage to local organs like bowel, bladder, uterus, and postpartum hemorrhage and postoperative infection. Grades of abnormal placental attachment according to depth of invasion into muscular layer of uterus. Placenta accreta: chorionic villi attached to myometrium but do not invade the muscle. Placenta increta: chorionic villi partially invade the myometrium. Placenta percreta: chorionic villi invade full thickness of myometrium and beyond uterine serosa. Ultrasound findings: loss of retroplacental hypoechoic zone, presence of multiple placental legs with turbulent flow, thinning of uterine serosa bladder wall complex in case of placenta percreta. MRI findings: heterogeneous signal intensity within placenta, focal interruption of myometrium, intraplacental bands in T2 weighted images. Placenta previa. Placenta previa refers to abnormally low-lying placenta. Risk factors are previous placenta previa, previous caesarean section, increased maternal age, increased parity, large placenta. Classification: Grade 1 low-lying placenta. Grade 2 placental tissue reaches margin of internal cervical os but does not cover it. Grade 3 placenta partially covering the internal cervical os. Grade 4 placenta completely covering the internal cervical os. I would like to thank Dr. HARSHAD SHAH sir, Dr. NIRMALA CHUDASAMA ma'am, Dr. Rashesh Vyas sir, Dr. Naveen Mehta sir and my colleagues and seniors.